Let's draw the parallel here. Let's go back to 2009, 2010. Republicans in particular have been eager to draw up comparison to how quickly they say it came together then. How different is this now than then?
Well, I mean, it really couldn't be more different. The Affordable Care Act the process started the minute Obama got elected and culminated 17 months later after dozens of congressional hearings with hundreds of people participating, after a process that was run by a bipartisan group of 3 Democratic and 3 Republican senators, and after multiple official nonpartisan scores from the Congressional Budget Office. Now you have a Republican alternative that's being jammed through in less than 3 months, with no hearings, with no engagement of Democrats, and without even having a score on what it actually does. I mean, we literally do not know what effect this law will have on the budget deficit, for example. We know it's going to cause a huge increase in uninsured. We know it's probably the largest single redistribution from poor to rich in our nation's history in one bill. But, for example, we don't even know if the deficit's going to go up or down. How can you vote in a law like that?
Jonathan, can you help me understand here how different these 2 iterations of this piece of legislation were? The CBO did score the first round of it, so the number of uninsured could go up by 24 million. Is there a chance that with this version of the bill, that number could be less?
Look, I think that the fundamentals of what's going to happen, we sort of know. The uninsured, it could be a little less, it could be more. We don't know. But it's not going to materially move, I think, from the 24 million. And likewise, we know that this is going to be a huge increase in the cost of health care for the sick, the poor, and the old. The piece that we don't know that could move quite a lot is the deficit number. The previous Republican iteration lowered the deficit by $150 billion over 10 years, which is really not much. This iteration likely increases it. So really, the last possible argument for this law then goes by the wayside. Literally, there is nothing to recommend this law anymore. It makes insurance more expensive, it increases the number of uninsured, and it increases the deficit, I think. But we'll have to wait and see what CBO says.
Again, looking back at the process in 2009, 2010, do you have any regrets about how that legislation made its way through Congress to the president's desk?
The only regret is I think that, quite frankly, the process there was too much effort to reach out to Republicans, especially after the summer of 2009. Just to remind people about the process, during the spring of 2009, there was this process with this group of six, 3 Republican, 3 Democratic senators who were charged with coming up with the actual language of the legislation under the purview of the Senate Finance Committee. They worked closely together, but then in summer 2009, there were all these town halls, and Republican voters got very upset. Republicans were cooperating. At that point, many Democrats were urging Obama just say, look, the Republicans aren't going to cooperate. Just have a purely partisan process. And he wouldn't. He waited like 3 more months before finally deciding he couldn't get the Republican votes he needed. But he made an enormous effort, including finally in early 2010 holding a 7-hour meeting at Blair House with Republicans and Democrats to hash this through and explain how the law would work. We see nothing like that in this process.
Help us look ahead here a little bit. We'll get this vote this afternoon. Say this legislation passes, it goes on to the Senate chamber. What's the outlook that you have when it goes to the Senate? Do you think that there's going to be radical change to this legislation if indeed it gets there?
Look, in this world, this post-Trump world, I can't make any political projections with any certainty. I do know that the margin's a lot thinner, that the moves to the right they made to get the House Freedom Caucus are not going to sit well with moderate Republicans in the Senate. And I think you're as likely to see them just declare this dead in arrival and start over as you are to actually start from this bill.
Last question here. We're going to dig into this a little bit later in the program as well, but we saw Aetna pull out of Virginia yesterday. What's the answer as you see it to these insurers getting out of marketplaces around the country? How salient is the competition issue?
Well, I think the competition issue is only salient to the extent that you have 0 insurers. As long as you have 1 insurer, the market's going to work fine, and if they make money, other insurers will enter. 0 is a problem because you can't literally deliver the subsidies with 0 insurers, and that is a problem. That's like a mechanical problem that under the Obama administration they worked hard to fix. But really, the big issue here is just insurers are facing enormous uncertainty under the Trump administration, and insurers don't like uncertainty. They like certainty. They like having a nice a nice plan of going forward. And so it's just easier for them, since this isn't the main source of their revenue, to just pull out of these exchanges rather than deal with that uncertainty. The number one thing that folks have to realize is if Trump had not been elected, these exchanges would have been working fine. All projections are that last year was a one-time aberration, and premiums are going to go up at a modest rate again this year. The uncertainty Trump's injected into this process is why premiums are going to go up a lot more, and we're going to have a lot more insurers exit.